Hello everyone, welcome to my channel, and in today's video we are going to discuss obesity counseling. So in this video we are going to discuss the data gathering part, that is what questions you need to ask these patients and what examinations to perform, and then we'll also discuss the counseling part in detail, that what sort of counseling you should provide to these patients. So basically obesity counseling can be a patient who is presenting to you and he's saying, Doctor, I have gained a lot of weight recently, or I am concerned about my weight. Or it can be that you have a patient who is presenting with some other comorbid conditions, like, for example, osteoarthritis or diabetes or hypertension, and you happen to notice that they are also quite obese. Their BMI is about 30, 35, and you want to do obesity counseling in these patients. So without further delay, let's start discussing the data gathering part. One other important thing is that you need to be very empathetic in these stations, okay? So be very careful of your words, be non-judgmental, because these patients are very, very sensitive about their weight, okay? So it's a very sensitive topic, so be very neutral and non-judgmental, okay? So as in every other station, we will start by introducing ourselves and confirming the patient details. We confirm two details, that is their full name and their address. And then we are going to start with an open-ended question of how may I help you today? And then we are going to, they may give you their presenting complaint, the doctor, I'm not happy with my weight. I've gained a lot of weight recently. Or I want to lose weight, or whatever. They're going to give you their chief complaint, and then we are going to ask closed-ended questions, okay? So the first thing is we are going to explore their weight. So we are going to ask some questions about their weight. We'll ask the patient to know what your current weight and BMI is, what was your highest and lowest achieved weight, okay, and what is the reason to reduce weight now, okay? So you are checking the motivation right now. What is their main motivation that they want to lose weight? Is it because of some physical complaint? Is it because of their mental health? Is it because some big wedding is coming up and they want to lose weight for that? Okay, so you are checking their motivation to reduce weight now, okay? Then we are going to ask about their previous attempts at losing weight. So if you have watched my smoking cessation counseling video, or drug abuse counseling videos, or alcohol cessation counseling videos, in all those videos we ask about previous attempts, okay? So from these previous attempts question, we get an idea of how many attempts they have previously tried, and did they get any help or not? What was the reason behind the previous failures? What are the things that we can work on right now to make their current plan successful, okay? So we are going to ask questions about previous attempts. We're going to ask the patient, have you tried to lose weight in the past? Okay. Did you seek any help at that time? Okay. So did they go to a dietitian? Did they consult a doctor? Or did they try it on their own? Okay. And why did it fail in your opinion? So you are asking about the reason of failure so that you can work on it this time. Okay, then we are going to assess their dietary habit and exercise habit, because obviously weight gain is linked to eating unhealthy food and not doing any exercise or insufficient exercise. So we are going to explore these two domains. So we are going to start with the dietary habits. We are going to ask the patient, how many meals do you eat per day? Okay, any snacks in between? Snacks, what do you eat for snacks? And then do you know how many calories you are eating per day? They might have an idea of their caloric intake. They might have calculated it. So it's a good question to ask, okay? Roughly, a calorie intake for males should be around 2000 kilocalories, and for females, it should be around 1800 kilocalories, okay? So if the patient is saying, I'm eating 4000 kilocalories, then you have identified the problem there, okay? All right. Roughly how much sugar do you consume daily in your drinks? For example, tea, coffee, and sugary drinks. So you asked about meals, you asked about snacks, and what do they eat for snacks? If they are eating high calorie food like cakes and cookies, high fat food, so like fries. So you identified the problem here in their snacks as well. So how many meals do you eat per day? What snacks do you eat? Do you know the number of calories that you are eating per day and how much sugar in your drinks? Okay, another open-ended question, like before asking all this, an open-ended question can be, can you please walk me through your daily diet? So then they are going to give you some details, and then you can ask questions, close-ended questions about the specific details that they have missed. Okay, so that's another way of asking these questions. All right. Then we are going to explore their exercise routine. So we are going to ask them, tell me about your physical activity. Do you work out at all? And if they are doing exercise, we are going to ask them the number of sessions per week and the duration per session. Okay. So that was about diet and exercise. Then we are going to rule out some differential diagnosis for weight gain. So the first one here is hypothyroidism. We are going to ask them any change in their bowel habits, any cold intolerance. For Cushing, we are going to ask about easy bruising. If it's a female patient, then you are also going to rule out PCOS, which is polycystic ovarian syndrome. So we are going to ask about acne. Do you get any spots on your skin, any excessive hair growth on your body, and how about your periods? Are they regular? Are they irregular? So you have ruled out some differential diagnosis as well. Okay, so that was all your history of presenting illness. Now we are going to ask them about their medical history. So any known medical condition like diabetes mellitus, any hypertension, any ischemic heart disease, and also ask about joint pains, okay? Because obesity can lead to osteoarthritis. So that was about their past medical history. Then we are going to ask about MAFTOSA. MAFTOSA is basically an acronym which stands for medication, allergy, family history, travel, and psychosocial. So here the relevant questions in Veftosa are medications. Are you on any medications at all? Because there are certain medications like antipsychotic medications, SSRIs, and oral contraceptive pills that are linked to weight gain. So you're going to ask about medications here as well. It's important, okay? Any allergies at all? Family history is important. Any family history of ischemic heart disease, stroke, diabetes, hypertension, kidney disease, because if they have a family history of these conditions and they are overweight, then it's going to increase their cardiovascular risk many times. Okay, so you're going to ask about family history. Don't forget, family history is important here. Okay, then psychosocials is also very important. So ask about their occupation. What is their occupation and their social support as well? Are Do they have family and friends? Are they supportive? And ask about the impact of being overweight on their mood. Okay, this is a very important question. The impact of obesity on their mood. Are they depressed? Because this is a screening question for depression, and this is very important because an overweight person, this is a very sensitive topic and also kind of a social taboo, and people tend to bully people who are either very overweight or very underweight. So and they are very conscious about their body image. So you should ask this question if it is impacting their mood, because it is highly likely that it is going to have an impact on their mood, and they might be depressed as well. So this is a very high yield question, and this is going to improve your marks and make you stand out among all the other candidates. Okay, so ask about impact on mood and daily life. Okay, is being overweight affecting their daily activities at all? Okay, so you are going to assess the severity of problem by asking these questions. And if they are depressed, then obviously you are going to ask about any risk of any thoughts of self-harm, okay, and harming others. So keep in mind, these questions are really, really important. I cannot stress this enough. And then CAFE. So CAFE is a mnemonic which we use for asking lifestyle questions like cigarette smoking, alcohol, food, and exercise. But we have already asked about food and exercise. So we are going to ask about smoking and alcohol consumption. And alcohol also contain a lot of calories. So if they are drinking a lot of alcohol, you are also going to advise them on cutting down on it. Then the next step here is asking about, so we are done basically with the history taking part. Now we are going to explore the patient's ideas, concerns, and expectations. So regarding the idea, you are going to check their understanding of what increased weight mean and what are the health implication of increased weight. So you're going to check their understanding. You're going to ask them a question like, what's your understanding of increased weight and its effect on health? Okay, so this is checking their ideas. Then concerns. Are you worried about any challenges that you might face while trying to lose weight? So you're trying to find out if they're worried about anything, about any challenges in specific that you can work on with them. So this was about concerns. Then expectations. Is there anything specific you are hoping that we could do for you today? Do you have any goals in terms of weight loss in a particular period of time? So you're checking their expectations. All right. Then physical examination. In physical examination, you're going to check their weight, their height, and calculate their BMI. You are also going to check their waist circumference. Waist circumference is important because it's a more reliable indicator of cardiovascular risk in obese patient than BMI. Okay, so don't forget about waist circumference. So after physical examination, investigations are usually not required unless you are suspecting another diagnosis like Cushing or PCOS or hypothyroid. So then you can order tests based on your suspicion to rule out a particular differential diagnosis. Otherwise, usually they are not needed. Okay. Then we are going to start management. So like every other station, we are going to start our management by explaining condition to the patient. Okay. So we are going to tell the patient from the information that you provided and from your physical examination, it seems like your weight is a bit on the higher side, okay? So your BMI, so you're also going to explain it to them what BMI means. So you will tell them your BMI, which is your weight against your height, is, for example, their BMI is 32. So we'll tell them your BMI, which is weight against your height, is 32, whereas normal BMI is between 18 to 25. This means that your weight is higher than what's considered healthy for your height. Okay. So you explain it to them, their diagnosis and what their BMI means. Now, in counseling, what do? We are going to tell them the benefits of weight loss and the harmful impact of weight gain. Okay, so you explain the conditions, now you are telling them risk versus benefit. Okay, so it is important to address this increased BMI because it can increase the risk for various health problems like diabetes mellitus, hypertension, and heart disease. Okay, so we have told them the harmful impact that it can increase various health problems. But there are benefits to losing weight, like improved energy levels and reduced health risks. Okay, so you have told them about the benefits as well. So risk versus benefit. And then we are going to lay out our management plan. So we'll tell the patient, let's break it down into simple steps. We can start by setting small achievable goals. How about aiming to lose 10% of your weight over the next 6 months? Okay. So you are phrasing the questions and in a way that you are kind of making a shared management plan. So tell the patient we can start by setting small achievable goals. How about aiming to lose 10% of weight over the next 6 months? And then you will wait for the patient's answer. They might agree with you. They might say, no, doctor, I want to lose 5% or 8% of my weight over the next 6 months, which is all right. Okay. Then for diet, we'll tell them that let's set a goal of of losing, for example, 10% of weight over the next 6 months. And then what we are going to do for losing that weight. So we are going to work on your diet and your exercise. Okay. So for diet, we'll tell them to try to eat home cooked meal with more fresh fruits and vegetables and less than 3 serving of red meat per week. Okay. Avoid eating cake or cookies or high energy snacks in between the meals. Reducing portion size and avoiding added sugar can also help. Try to keep track of your progress by keeping a food diary. It will help you being consistent and you can review it if things are not going um, according to what we planned. Okay. So tell them, give them some tips and tricks of healthy diet. We all know that home cooked meals are good. More fresh fruits and vegetables are low calorie as compared to red meat. Cake and cookies and high yield snacks in between the meal can increase our weight. Reducing portion size and avoiding added sugar are also helpful. And then tell them to keep a track of their progress by maintaining a food diary, and ask them, do you think you can do that? Okay, because you are going to make a shared management plan, so you're going to keep asking these questions in between. So do you think you can do that? And then wait for the patient response. Then for exercise, tell them that in terms of exercise, starting with something simple like 30-minute exercise most days of the week can make a big difference. How does that sound? Okay, so 30-minute exercise most days a week can make a big difference in weight loss. Right, so exercise, that's done. And then you can tell them that I can also refer you to a dietitian if you think that it might help you, and they can help you in making some meal plans. Okay, um, and then you're going to arrange a follow-up appointment with them. Let's schedule a follow-up appointment in a month time to see how you are doing and adjust a plan if needed. And then appreciate them, tell them that you are taking a great step towards better health, or you did a great thing by coming in today. Do you have any questions for me? So and then you are again checking for any questions or queries that they might have. And then uh, tell them that greet them goodbye, tell them that thank you for coming in today. We'll see you again in a month time. Take care. Okay, so now regarding pleb 2 stations, this uh, end of the station and beginning of the station, this should be powerful. Like you should be greeting the patient in a very confident and cheerful way in the start and in the beginning as well. For me, it was a big challenge when I was preparing for pleb 2 exam, because for me, even in normal circumstances, socially, like the introduction are always awkward and the goodbyes are also always awkward. So you need to work on this. If you are also like me, you need to work on this. You need to, I think most of the introverts have this problem, but you need to work on this. You need to really sound confident and cheerful while greeting the patient and while introducing yourself and while saying them goodbye. So work on this if you're also having problems, because if you are a little bit down in the beginning and also at the end of the station and you are sounding like a bit unsure of yourself, then it's going to give a bad impression and you might lose some of your marks. So that was another tip. Also in this station, be very, as I told you in the beginning as well, be very empathetic. Whenever the patient tells you it's very overwhelming, it's difficult for me, also always try to reciprocate, tell them that yeah, it does sound challenging, it must be very difficult, I see where you are coming from. Okay, so use these sentences a lot in these stations. And then for your knowledge, I have added this point here. um, when you start a patient on diet and exercise program and they are following their diet and exercise program, but still after like strict diet and exercise, still their BMI is more than 30 or their BMI is more than 27 with comorbidities. So comorbidity means that they have diabetes or hypertension or ischemic heart disease or osteoarthritis, so complications of obesity. Then you can start them on early state. It is a first line medication for weight loss, but it's only given after you have tried and failed to lose weight with diet and exercise. Okay, and then the third option can be bariatric surgery, which is done at BMI more than 40 after diet and exercise and medical therapy has failed, and still the BMI is more than 40 or BMI is more than 35 with comorbidities. Okay, so that was all about obesity counseling. I hope it was helpful, and I will see you soon with the next video.